I mean, it doesn't matter that they're my friends in terms of actually stopping the unfair and unequal treatment to which they may likely be subjected. And none of this stuff that I'm talking about here, whether we're talking about the job market or the criminal justice system or housing or healthcare, I should point out, because there are about 100 studies in the last decade which have found two very important things, neither of which got mentioned in the healthcare debate, right? Which I think is really instructive that they didn't get mentioned. Because if you listen to the healthcare debate, you would think that it was just about coverage. It was just about affordability. So if we can just make sure it's affordable for everyone, everything will be fine. But what the 100 studies have found is that the biggest disparities between white folks and black folks, for example, are not at the issue of, not related to the issue of whether you have coverage. Right? It's not about economics. It's not about the financial end of it. Now, I'm not saying that's not important, but that's not where the racial gaps manifest. The racial gaps actually manifest at the top of the income spectrum. Right? The biggest gaps are between white and black folks, all of whom have good jobs and decent health care and pretty good incomes, because the white folks at that level almost inevitably have, on balance, really good health, and people of color, lousy health. Right? Black women who have college degrees, good jobs, good incomes, and health care actually have higher rates of infant mortality for their children, for their newborns, than white women who dropped out after the 8th grade. Right? And who are poor and don't have good health care. Right? We have evidence that the cumulative effect of racial discrimination on people of color over many years is having health consequences in terms of blood pressure, in terms of the release of stress hormones, right? In terms of what physicians call the allostatic load. Right? This big sort of fancy terminology, but allostasis is this concept that the body returns to normal after periods of stress. It's the ability of the body to adapt to stressful situations and then sort of return to balance. And what the evidence says is that for folks of color, there's so much allostatic load, so much loading of these stress factors that you can't return to normal. So you have black folks going to sleep at night being monitored and their blood pressure is not dropping at night. Right? Which is what for white folks it does. Like white folks go to bed at night, for the most part, your blood pressure drops, even low income white folks. Black and brown folks who are not poor, right? Whose lifestyles are fundamentally the same, whose diets are fundamentally the same. As white folks are going to bed, their blood pressure is not dropping. It's like there's something happening, right? And the research says it's about racial inequity. The fact that some of those black folks have got white friends, it doesn't stop that. Right? The fact that I've got some black friends, I'm not there with them to wake them up and tell them, relax, right? Relax, it's okay, really. Let your blood pressure drop. That doesn't work that way, right? And the other studies have found that doctors are often receiving unequal treatment. Doctors are often providing unequal treatment to patients. They're not doing it on purpose, right? Most doctors are not, racist in that traditional sense of the word or bigots. Most doctors are caring professionals who want to make sure all their patients live and are healthy. That's your incentive when you're a doctor. You want to do right by your patients, but doctors are subjected to the same stereotypes that we're all subjected to. Right? They internalize the same things. They see the same media imagery. They have the same impressions. They've done studies with medical school students where they take them and they sit them in a sort of an experimental setting and they show them videos of people who they think are real patients, right? But really they're actors. And they basically are describing the same symptoms. One of the actors is black, one of the actors is white. They show them separately, right? And then they're describing the same symptoms. They have the same insurance coverage. They have the same occupational status, right? In every way, they're really indistinguishable except for race. Their communication styles are the same, right? And yet when they're done, they end up getting very different prognosis, diagnosis, and intervention recommended, right? The white patients, the doctors give much more sort of immediate intervention, much more dramatic sort of hardcore intervention to save their lives. They take the illness more seriously, even though it's the same illness being described. At the end, they do a post-study interview where they ask the medical school students about their perceptions of the quote-unquote patients, right, who they believe to have been real. And they say things like, that they perceive the black patient as not being as smart, not likely to follow a treatment recommendation, not likely to make appointments on time, not likely to take their medicines regularly, right? Is that about overt bigotry? No, but it's about this internalized bias, this presumption about, who's sort of better in some sense and who's worse. And so even doctors who are good caring professionals do that. The fact that some of those doctors probably have black friends, right, if they're white. Some of them probably have Latino friends. They may be married to a person of color, and yet, right, those stereotypes can still exist. And none of that ended just because the President of the United States is a man of color. Right, which is something we need to also get our heads around, because a lot of times people say, yes, I understand this is all true sort of historically and this has been an issue. Only a fool would deny that. But a lot of those same people will say, well, but pretty soon that'll all be over with if it's not already, because the president is Barack Obama. And so since he's a man of color, surely we'll get over this stuff. And then young people, college students will say, oh, well, this is like y'all's problem, meaning people my age and older, right? This is 40 and 50 and 60 and 70-year-old people's problem. This is not our problem. We sort of don't see color and we don't think about it. But now here's the thing, right? Before I talk about the inadequacy of Obama in that sense. There was a study done recently by two sociologists, one at Texas A&M, the other at the University of Toledo or Dayton, one or the other. Did a book called Two-Faced Racism, Leslie Pica and Joe Fagan. And what Fagan and Pica did was they were curious about young people, and college students in particular, and the degree to which racism manifests among younger people. Because so often younger folks are like, oh, it's not us, that's y'all, it's not our problem. So what they did is they had 676, or 626, I guess, white students at 24 colleges around the country, some private, some public, all around the country, right? Keep journals for 6 weeks, where they were asked, during the course of that 6 weeks, these white students, their only job was they had to write down and chronicle in the journal every time that they were in the presence of other white people who told a racist joke, who made a racist comment, or who acted out in some racist way vis-a-vis people of color. Anything that could be interpreted as sort of a racist performance or act of some sort, right? And so they did this for 6 weeks. 626 white students keeping these journals. At the end, they collected the journals. When they looked through the journals, there were 9,500 incidents that had been chronicled by these 626 students over a 6-week period. Now, Fagan and Pica, trying to be fair, excluded 2,000 of those from consideration because when they looked through them, they were a little vague. They were things that sort of borderline, like, you know, not a clear call. So if it wasn't clear, they excluded it. They wanted to have the lowest possible estimate. They only left the 7,500 cases that were blatant, right, that were just obvious that this is racism, straight up. 7,500 cases in 12 weeks, 626 students, basically 2 a week per student per week throughout the course of the overall. Is 12 incidents per person, or 2 a week. And then you multiply that, if you think about this is randomly selected students at colleges. Think about what this would mean if you multiplied this throughout the country. Right? If we're really seeing that kind, if we're hearing that kind of racist or racially prejudicial behavior, how can we believe that's not having an effect on us? And how can we say, oh, it's not us, it's not our problem, this generation has it all figured out? See, we have some things figured out better than we do, and we had some things figured out better than our parents, but there's quite a bit of ways to go. As far as President Obama, the idea that somehow his election would erase any of this or make this go away just doesn't make any logical sense. So if you think about, for example, the nation of Pakistan,